Hey guys, Ashley with Amare. So few resources for you guys. We are located in Elizabeth and Highland Park, New Jersey, and I also offer virtual consults. So if you guys need my help, give the office a call, 732-841-0142, and our scheduling coordinator can help you get set up with an appointment. We also have our online shop. So all the products that I talk about in my videos, those are all in our online shop for you guys to purchase. On our Instagram, Amare Healing Arts is our Instagram. All the products are linked right there in our bio. Also, the online shop is linked, and it's linked in the description box for each video. So you guys can go and check those out. And then we have our online course school, the Post-op Academy. So all of the things that you would need to know post-op, we are doing online courses for. So things like what kind of massages you need, when you need to get them, who to get them from, how to find a therapist like me, all of that we have online courses for. There are going to be more courses coming out all the time. So check in on that to see what's new and what you guys can learn. If you like my videos, all of those courses are exclusive content. All those videos are exclusive content. None of them are on YouTube. They're all in our courses. So that is amarehealingarts.teachable.com. The link for that is also in the description box, and it is also linked in our bio on Instagram. So I hope you guys enjoy the content. Ashley with Amare. I will see you soon. Bye. Hey guys, Ashley with Amare. Hi. Okay, so today we're talking about scars after plastic surgery. Let me start this video off by saying scars do not need to happen. Now, scars will happen, but they do not have to be dark and thick and angry and crazy like you see on social media. Those are wounds that were not taken care of properly. That's how they became a scar. A scar starts as a wound. If we take care of the wound to begin with, it doesn't turn into a scar. A lot of the scars that you see that get real crazy are due to swelling. And I have a fancy little article here by ncbi.nlm, National Library of Medicine, medical journal article. I'm only going to read 3 or 4 parts because this article is really, really long. And there's a lot of medical terminology. There's a lot of stuff about like genes in here and all the types of like wound healing and things like that. But I'm going to break it down for you guys like I always do. But yes, okay, so summary of all of this, because it's going to get real technical, and I'm going to break it down as best as I can for you guys. But summary, a scar doesn't happen from just a scar. It happens from the wound. It's damage to the wound while it's healing that causes it to scar really bad. So when we're talking about a tummy tuck incision or even just little like pinholes from liposuction, it's the skin around the incision that's causing the scar to be dark, the abuse to the skin. So whether it's too wet or whether it's too dry while it's healing. The number one mistake you guys make with your wound healing that causes a scar is making the wound itself too wet or too dry. Too dry is when you have the scab and it's dry and thick and hard and flaky and the skin around it is starting to peel away. Too wet is when the scab keeps coming off and the skin around it is really red and it's mushy. We don't want that. We want it to be like Goldilocks, right in the middle. So we want like a nice flat scab with the skin around it that looks really healthy, nothing that looks red around it, nothing that's peeling or flaking. Now I also know that like redness around it can be a sign of infection, right? But let's say we're not talking about that. Let's say we don't have an infection. I cannot tell you whether you have an infection or not. This video cannot tell you that. So just so we're aware, we're talking about, let's say like a paper cut, right? The other thing that's a big factor as far as if it turns into a scar, and this also isn't really a big factor, but it does play a role, is the environment. So if it's on your knuckle and it keeps splitting open, right, that may scar a little bit worse, but we can prevent that. Ta-da! All right, so let's get into this. So the abstract of this article. So it says, a number of tightly coordinated regenerative responses, including homeostasis. So scars have to do with the 4 phases of wound healing. For you guys who don't know, the 4 phases of wound healing are homeostasis, where there's bleeding and clotting, right, where it's making a scab. Then it's inflammation, where it's bringing in all of the proteins to make new tissue, which we're going to get into in a second. Then it's proliferation, which is where all those proteins are laying down, like weaving together, making the new skin underneath. Then it's remodeling, which is where they're becoming permanent. Those are the 4 phases, because it does talk about that in here. So including homeostasis, the migration of various cell types into the wound, inflammation, which I just mentioned, right? That's where we get the swelling, angiogenesis, which is the proliferation remodeling, and the formation of extracellular mixture, hint, hint, that means swelling, are involved in the healing process. In this article, we summarize the central mechanisms and processes in excessive scarring, which is what we're talking about today, and acute wound healing, which can lead to the formation of keloids or hypertrophic scars, which is like the lumpy, bumpy, red, raised, everybody's super worried about scars. The two types of fibrotic scars, hypertrophic and keloiding, and I have a video on fibrosis if we need to know more about that. It's on our YouTube, caused by burns or other traumas, resulting in significant functional or aesthetic disadvantages. In addition, we discuss recent developments related to the function of activated fibroblasts. Sounds like fibrosis, right? I have a whole video on that. The extracellular mixture, swelling, and the mechanical forces in the wound environment, as well as the mechanisms of scarless wound healing. Understanding the different mechanisms of wound healing is pivotal for developing new therapies to prevent fibrotic scarring of large skin wounds. So it's all about the wound healing. When we talk about scars, it's all about the wound healing. I'm just going to pop this in here real quick. I'm going to do another video specifically on when you should be using scar treatment. Today we're just talking about the scar thing itself. You are not using any scar treatment until you're like 6 months out. No silicone strips, no silicone tape, no silicone scar stuff. That thing is not a real scar until the wound and skin are completely healed. There's no redness. There's nothing like that. When it is a silver, white, flat line, then you can start using scar stuff on it. But if that thing still has a scab, if the skin is still red, if it's still puffy and swollen, that's not ready for scar stuff yet. That's still part of the wound healing. So, the next part. Tissue damage repair aims to restore tissue integrity and consists of complex and tightly regulated biological processes involving extensive cooperation of several cell types, growth factors, and cytokines secreted by them and surrounding ECM extracellular mixture. So what that means is the tissue damage repair thing, that's the swelling part. The swelling is coming in to repair the tissue. The swelling is what makes new tissue. If you want to make sure that you don't scar really bad, you need to make sure you're taking care of the swelling, which is then going to affect the wound healing. So we'll get into that in a second. Adult skin wounds heal by scarring, which restores the barrier function of the skin, thereby preventing the body from dehydrating or leaking out, and protects the wound from infection. A normal scar is composed of loose, fibrous connective tissue and is slowly remodeled during the healing process to become stronger. So let's stop there for a second and explain this. So loose fibrous connective tissue, that fibrous connective tissue happens in the swelling process. Swelling is what starts to make that fibrous connective tissue. It's supposed to stay loose and fluid and liquid and soft, and then your body reabsorbs the excess it doesn't need, and all those proteins lay down nice and pretty and flat and heal to make a beautiful, pretty little scar. Where it goes wrong, the red, angry, big things that you see with those scars, like tummy tuck incisions that are super raised, I have a bunch of them on my Instagram, pictures of that stuff. That's because there's swelling behind the wound that gets trapped there and doesn't heal. So I have fuzz on my face, sorry. So when we're talking about your scars healing raised, the key to that is getting rid of the swelling. And the way to get rid of the swelling is manual lymphatic drainage massage, not rubbing the ever-living daylights out of it, but actually doing the technique, this gentle skin pumping, stretching, very gentle motion to get your body to suck the swelling back from underneath the wound or the scar into the body, into your bloodstream, and then you pee it out. That's how we get rid of that. So if you guys are having issues with your wound healing, where your wounds are healing raised, it's because you're still swollen. And when we get that swelling out, even at 6 months, those scars start to flatten. So that's how that part works. Fibrous connective tissue and slowly remodeled during the healing process to become stronger. So when we're talking about the healing process, let's take something like a tummy tuck, right? Because the scar is really big, or breast scars from breast augmentation. When we're talking about the healing process and you're talking about an area that's constantly moving, when you expand your rib cage, you breathe. When you are bending or reaching, you're constantly putting pressure on that incision or moving that skin. That's going to be a little bit of trauma to the area, and it's going to swell. We want that thing to heal nice and slow and flat. We want to not baby it, but protect it. So when I say protect it, when we have garments, like I know a lot of breast augmentation garments, they have that thin elastic band that puts pressure right into that incision. That's where the lipofoams come in. So guys, if you have even your little pinpricks from your lipo, if those wounds aren't protected properly, I'm not talking about a tank top or gauze. I'm talking about the Amare lipofoams, which will still give you that compression and lymphatic stimulation, but it will keep the garment pressure when you move or bend or anything like that. It will keep the garment pressure off of the wound directly. That's going to help make sure it doesn't scar, because we're not adding any pressure onto that to make sure that it remodels slowly, rather than your body thinking, oh, this keeps getting damaged, I need to keep sending swelling in so that this is protected. Or the same thought, just kind of the reverse, where that wound keeps getting damaged and swelling keeps coming in to repair the area. So swelling is doing two things. One, it's coming in because that area keeps getting damaged by the garment. And two, it's coming in to kind of like make the tissue stronger and buffer the area, because your body thinks it needs to, because it keeps getting that pressure on it. So having the lipofoams is your number one thing to make sure that your incisions are not scarring. Number two is the actual wound healing itself. So again, making sure we're not using Neosporin, Bacitracin, and Vaseline, anything that's going to compromise that tissue and keep it wet. And make sure we're not using Dial Dove and HipoCleanse past the point where there's a scab, because that's going to dry it out. And then any kind of movement or mobility, that skin is so dry, it's going to crack, and then your body's going to create that inflammation to try and again heal it nice and strong. So healing process to become stronger. Chronic inflammation of the skin and uncontrolled function of activated connective tissue cells, myofibroblasts, may lead to abnormal overgrowth of scars. Guys, chronic inflammation, we're talking about surgery. We're talking about swelling. If you are not getting this gentle manual lymphatic drainage massage to get that swelling down, and it's just sitting underneath that wound, putting pressure on it, and all that swelling is sitting there, you're going to scar. It's not going to heal nice and flat, or your wounds are going to take a lot longer to heal than they need to, because they have all that pressure on it. So uncontrolled function of activated, uncontrolled function of activated connective tissue cells, myofibroblasts. So again, those connective tissue cells, because of all that swelling, are in there and they're being activated and they're causing all this buildup. The scar itself is just the buildup of the swelling and the trauma and all of that. It's all about the wound healing. That extracellular mixture, that chronic inflammation, that's all swelling. So if we're taking care of the swelling, your wounds are going to heal flat. Here is the pretty picture, because I always give you guys analogies, right? If we're sewing together a piece of fabric and I'm pushing on the fabric and trying to stitch it together, that fabric's being pulled. The fibers of the fabric are being pulled. When you put the needle through that, because there's so much tension on the fabric, it's not going to sew down flat. It's going to sew down lumpy and like weird, and the fabric's not going to lay flat when you release it, because it's got all this pressure and tension on it. But if you have two pieces of fabric and they're just laying nicely, and then you go and sew it together, it's going to be nice and strong and flat. So it's the same thing with your wounds that then turn to scars. If they're not laying down flat, there's going to be all this pressure behind it. And when your body goes to activate those connective tissue cells and it goes to make that connective tissue, it's going to make it really thick and it's going to lay it down all lumpy and weird, because it's not, the skin is not flat to heal together perfectly. It's kind of like, and I hate saying this because this is a whole nother video and I don't want you guys to get the wrong idea, but when they pull a tummy tuck too tight, right, it doesn't heal right. The skin pulls and rips and can reopen because it's too tight. There's too much pressure on the incision. So key things as we're going through this to remember: pressure on your incision or your wound, whether it be external, but most of the time the culprit is internal. So external being from the garment, or internal swelling that you're not addressing, or fibrosis, that hard thickness underneath your incision. That is going to cause scarring and discoloration. The wound itself while it's healing, right? So the incision where the scab is, but the wound itself while it's healing and closing. If the wound itself is red and swollen, let's say you do have an infection, that can be something that's going to cause more scarring during the healing process. I keep getting fuzzies on my face. I'm sorry, guys. It's very distracting. But that's that part. And then the next part, okay, so deposition of ECM, extracellular mixture swelling, and temporary scar formation are a part of normal healing processes. Like I say all the time, guys, swelling is healing juices. You need that stuff to heal. However, accumulation of abnormally organized, like I just said, abnormally organized stiff extracellular mixture swelling that replaces the normal tissue is a characteristic feature of fibrotic scars. The most important cells promoting scarring and fibrosis are activated fibroblasts, myofibroblasts that secrete high amounts of ECM, swelling, extracellular mixture components with abnormal structural and mechanical properties and with an altered capacity to bind growth factors. So like I said, that binding together, right? So what this is saying is, when we have that excess swelling, that abnormally organized stiff fibroticness in there, right? It makes it it alters the growth factor or the laying down or the binding of the tissue when it's in that proliferation phase. So abnormal swelling in the inflammation phase, right? Swelling that's not going down, swelling that's becoming stiff and hard and thick in that inflammation phase in like, let's say up to a week, 4 to 6, right? If we're not addressing that, that will stay in there and it will start binding and it will be abnormally binding and it will start to heal that way. And that's how we get scars that heal really bad. So the key to all of this, as this article is saying, this medical journal, is the swelling, is that extracellular mixture, is where all those proteins and myofibrins and myofibroblasts, it's all of that stuff, like it said in this paragraph, your body needs that. It's part of the normal healing process. The problem is, and we'll get into this in a second when I'm done reading this, the things that you guys are doing that you're trying to use to heal, like your extremely aggressive massages or pushing fluid out of your body, where you keep pushing fluid towards an incision, things like that are causing that accumulation of that extracellular mixture, which then creates that abnormal binding and all that bound up scar tissue, which I know we're talking about external scars because they're easier to visualize, but guys, when we're talking about fibrosis, when we're talking about scar tissue after lipo, this is what's happening. This is where this is coming in, and it's coming in the body. You're just not seeing it. It's easier to picture it in your head when you're thinking about a tummy tuck scar, but your lipo area is one big wound. So it's under your skin. It's not a tiny wound you see on top. It's one big wound under your skin. All of this is still happening underneath there. You just don't see it. So, ultimately, excessive swelling, accumulation, extracellular mixture, and cross-linking leads to increased tissue stiffness and pathological scarring, causing impaired function of the skin. The rest of this article is really long. I am going to dive into other parts of this article in a different video. I just wanted to give you guys the highlights of the sciencey things. Okay, so now that we've read all of that, what are the things that you guys are doing that you need to stop doing because they're going to cause you to scar really bad? Well, number one, stop worrying about your scars until they're actual scars. You guys are doing way too much too early. Couple examples of the wildness I have seen in my office this week. Using bio oil on a scab not even 2 weeks after surgery. Would you put oil on a scab if you burned your hand? Would you put oil on a scab, or even scar stuff on a scab in the first 2 weeks? No. So we are not going to do that with your body because you guys are so like hyper fixated on, oh my God, I need to make sure I don't scar. I don't want to scar. I don't want to scar. But then you wind up doing all these things which get in the way of the normal wound healing and cause the scar anyway. So if it's a wound, we need to treat it as a wound. Let's treat all of your incisions and your whole body as a wound until 6 months. Okay? So would we use oil on a scab? No. Would we put silicone on a scab? No. Would we put scar sheets on a scab? No. Would we go massaging and raking over a scab? No. Now, what about when we don't have scabs? So we know all of that stuff, right? Let's use common sense. We're not doing any of that when it's a scab itself. Let's first of all, before we go into what happens when the scab falls off, let's talk about taking care of it. How do we take care of these wounds to make sure that they are not going to scar, or they're going to minimally scar? Let me explain to you guys what I mean. Let's see if you guys can see this. Do you guys see this tiny little silver line here? I know it's really hard to see. But the darkness on the outside, because it's on my wrist, oh, there we go, is the abuse to the skin. The white line is the scar itself. See how flat this thing is? Your scars don't have to heal all lumpy and bumpy. They can heal flat. But the darkness around it is because it's on my wrist and I'm constantly moving it all the time. So the skin got a little bit abused. I know it's hard to see because it's a tiny scar. But that white line should be the scar. All of your scars can look like that. They don't have to heal all crazy. I don't know if I have any other scars that I can show you guys pretty easy. I don't think I do. But they don't have to heal like that. They can heal, and they're supposed to heal as that white line. It's the darkness around the incision that makes the scar really noticeable. And that's because, again, the skin is being abused. So when we talk about taking care of the incision, we want to make sure, like I said, that pressure and that mobility, that it's protected. Number one. Number two, stop dousing it in Vaseline and Neosporin. So here's how we know if we're doing too much. And we're going to talk about when your doctor gives you antibiotic ointment in a second, because that's a different story. But here's how you know if you're doing too much. When your scab keeps being mushy, it's too wet. Makes sense, right? But when you're starting, look at the skin around your incision. This is how you guys are going to know. Look at the skin around your incisions. If the skin is flaking and peeling back, it's your soap. You need to get the Amare gentle cleanser from our shop that is made for surgery, number one. Number two, if around, like the skin around it seems very mushy and wet, the wound care you are using, whatever it is, the Vaseline, the Neosporin, that stuff is meant for scrapes. And that stuff is meant for like, oh, I scraped my knee, I'll put this on it. And that's it. Once it scabs, we stop using it. We don't continue using it. When you're talking about using something, and this is the antibiotic ointment part, when you're talking about using something on your incision, your surgeon will give you an antibiotic ointment if there's a risk for infection, if they feel like you need it. But when you use that, guys, if it's prescribed by your surgeon, you're not glooping it on there. Put a very thin layer and make sure your incision is dry before you cover it. We don't want to trap any moisture. That's how we get bacterial overgrowth, especially in an area like under here where there's already sweat glands and moisture. Number one. Number two, if you are not using a wound care, go to our shop and get the silver gel that we have, the wound care. It is colloidal silver, nanoparticles suspended in aloe. The aloe will act as a liquid Band-Aid. On that product page, I have a video showing you guys how to use it, explaining the product, all of that. But quick rundown. The aloe will act as a protective barrier, like a liquid Band-Aid coating almost. You're going to put a good amount on there because it's going to dry. The nanoparticles of colloidal silver. Colloidal silver is used in Silvadene for burns and antibiotic ointments and things like that. Colloidal silver stays active in the wound for like 4 to 6 to 8 hours and actually heals the wound from the bottom up. So if you have scabs, or if you, like when you get your drains out, that's what you're going to use. You're going to use that, and you're going to use a good amount and make sure it is dry. You don't want wet things on your incisions. You want them to be dry. I know a lot of people that will take a blow dryer, especially for under here, cold air only, and just blow dry so that it's all dry before they put a gauze or something on there for protection, for leakage, for whatever. But just take a look at your incision, guys. If it is puffy and red, or not just red, but if it is puffy, right? If your tummy tuck incision is puffy, that's an indication that you need the lipofoams. If it is wet and the skin around it is really wet and compromised, that's going to be your indication that you need to be using our wound care. If your skin is dry and cracking and flaking and like peeling away from your scab, and your scabs are thick and hard and they hurt, that's an indication you need to change your soap. So if you don't have any of these problems, right? Let's say you just started, you now have your wounds, and honestly, this is good practice anyway. Start with the gentle cleanser. Start with the wound care now. You don't have to wait until, a lot of you guys wait until you have a problem. Now, let's talk about your surgeon's instructions because we always need to follow that first. So some surgeons will say, don't put anything on it, leave it alone. But then you're using Dial Dove and HipaCleanse and it's ripping up your skin. You're flaking, you're peeling, your incisions are ripping up like crazy. They hurt, they're constantly cracking, they're bleeding. Change your soap, but don't put anything on it if your surgeon told you not to. If your surgeon didn't give you any instructions, get the gentle cleanser, get the wound care, and start using it now. Your wound care you should be using 3 times a day. Mild application 3 times a day on there. Keep them nice and protected. That will hydrate without keeping it wet and sticky. It'll also help close the wound a lot faster. So using those 2 things. But if your surgeon told you not to put anything on it, then don't. Just make sure you're using a soap that's not going to rip you up. Because that's the problem, is the skin integrity. Now, talking about the swelling, you need the Amare lipofoams in your garment to make sure you don't heal with swelling behind your wound. Here's why I say that. Because when you guys come to me with a tummy tuck incision, we are not going to be working the skin of the incision. That thing's trying to heal. We want that skin to stay with its integrity and stay intact. So we're going to put the foams on there to protect it, to make sure that it heals flat, to make sure that it has soft compression, to make sure the garment's not digging into it. And we're going to work the surrounding area outside of the incision, like away from it, so the skin isn't moving or being pulled. And we're going to make sure that the body is sucking the swelling away from that incision area. But we're not working directly on incisions. Let's now get into the part where I talk about all the things that you guys are doing that are making it swollen. Because we know it's the products that we're using and it's the garments that are digging into our incisions that are damaging the integrity of the skin, right? And we're going to get into the skin thing, I didn't forget, where we talk about what happens when the scabs fall off and what do we do then, right? Because it's still a wound that's healing. That skin is not full skin yet. It does not have integrity enough to be using scar gel on it. So we're going to talk about that in a second, but let's talk about the swelling part first when you're still fresh. Rollers, aggressive massages, constantly reopening the wound to squeeze fluid out of it. That is not lymphatic drainage. I say it in every video. That is not manual lymphatic drainage. That is squeeze massage, and that is not going to help with your swelling, not in the way that it's supposed to for your healing. So when you are constantly putting pressure on that wound, you are squeezing that wound, you're squeezing fluid into that wound, the skin around that wound's going to get inflated and it's going to hold the wound open and have trouble healing, and if it heals, it's going to heal in a big bubble. Guys, when you have a pimple, and you squeeze and squeeze and squeeze and squeeze and squeeze that thing, there's nothing coming out of it, but it's massive. Like the skin around it is massive, and you could squeeze till the cows come home, nothing's gonna come out of that thing. Because all you're doing is pushing fluid towards an area, towards an opening, and the fluid's not gonna come shooting out of there. It's just going to stay in the tissue because that's where it is in the tissue. It's the same thing with your incisions, guys. You're constantly pushing fluid into that tissue, like that fabric that's now really, really thick from the swelling, and that fabric's trying to lay down flat, but it's so thick that it's going to make the tissue really thick. So squeezing your incisions constantly to push fluid out, or rubbing over your incisions constantly to push fluid out, or just trying to rub in general, not a thing. I know they start telling you to do scar massage when your scabs fall off, but again, guys, that skin is really thin. It's not at its full integrity yet. You're constantly pushing fluid to that really thin skin, that thin layer on top, but it's still healing underneath. So you're going to make your scar heal really thick if you're constantly rubbing over it and you're still in those early phases of wound healing within those first 3 months, 4 months, 5 months, right? So if we still have swelling, even though we don't have scabs, that wound is still healing. That wound is not healed yet. Just because you don't see a scab doesn't mean it's healed yet. It's the same thing with like a muscle repair or lipo. Just because you don't see a wound doesn't mean it's healed. Just because you don't think it looks bad doesn't mean it's healed in there. You guys can't see what's going on underneath. This is why we have the phases of wound healing. This is why we have this science to explain it to you guys, because there's a lot more going on under there than you think. I know a lot of surgeons will tell you, oh, you have no more scabs? Start using your scar stuff. If it is not a silver, thin, white line, do not use any scar things. If it is still red, purple, pink, still healing and having circulation issues, Do not use the scar things. It will turn purple and have color issues. And when I say this, I know you guys are using the scar stuff. You're going to take your scar sheets off and be like, oh my God. Or you've already taken your scar sheets off and you've been like, oh my God, why is this purple? I don't understand. Why is this really red? I don't understand. Because you're starting too soon. You're starting your scar massage too soon. You're starting your scar treatments too soon. You're starting your Mederma, your silicone scar sheets, your scar away, all of that too soon. Guys, wait to do all of that stuff until like month 4, month 6. But if you are still swollen, you are definitely not doing any of that stuff. Why? Because there's still pressure behind that skin. And then cutting it off from the oxygen with the silicone scar strip is only going to ruin the integrity of that skin. The integrity is already compromised because of all the pressure behind the skin itself, and then we're suffocating it from the other side with the scar stuff. So we want to make sure we get that swelling down first, let that skin gain full integrity, and then put the scar stuff on it. So this is why it's hard for me to give you guys a timeline, because I know there are you guys out there at month 4 with tons of fibrosis and swelling still, and your scars are all lumpy and huge, and you're like, oh my God, I'm keloiding. You're not keloiding. Your scar's still trying to heal. It's not even a scar yet, it's a wound, and you're still swollen everywhere. So there is hope. If you are still swollen and fibrotic, if that scar, if not even just the scar, but if your area of surgery is still swollen, still like pudgy, still squishy, or hard and thick and heavy, you are still swollen. That wound, what used to be a wound that now has skin over it, that is still swollen, that is still trying to heal. Before we go doing any kind of scar stuff, let's address the swelling first. Because that's where it's starting, as we read in our article, right? It's starting from the swelling. That's what's causing it to make into a scar eventually. So we don't want any of that excess in there. Let's get that out first before we start trying to use scar strips and all kinds of craziness. Because just because you don't have a scab doesn't mean that skin is healed. If that skin doesn't feel nice and thick and healthy and you run your hand over it and it feels like the same consistency as the rest of your skin, it's not ready yet. That's still a wound technically that's healing. It's not a full scar yet. So other things that you guys are doing, other than using your things too soon and causing all that pressure on the incision from your squeezy massagey things or your oil rubbing, other things that you guys are doing, nutrition. Nutrition when it comes to wound healing. If you are not drinking enough water, your wounds will have a very hard time healing. Because again, extracellular mixture, swelling. Water is the vehicle by which proteins, white blood cells, and fats, which are the things, the proteins are the myofibrins, myofibroblasts, fibrinogens, collagen, elastin, all the things we read in that article, those are proteins. Those live in your swelling or your extracellular mixture. So all of those little, like, think about them as grains of sand, they all get transported to your wound and then transported out of your body via water. If you are dehydrated, if you are having anything other than water while you're healing, any other liquids, caffeine, so green tea, black tea, like all these sugary juices, salty drinks like Gatorade and Pedialyte, all of those things are going to cause issues with wound healing. Now, yes, there are tons of things that you can eat to help with wound healing. There are lots of plastic surgery nutritionists out there that tell you things to eat with wound healing. But if you're eating those things and still drinking all the other liquids and not having enough water, your wound is not going to heal right. That skin is not going to heal right. Water, 2 to 3 liters a day, 90 ounces of water a day is what you need. So water is the number one thing. Getting your foams to make sure that you are cushioning your body and your tissue in the entire surrounding area that you had surgery in your garment so that it's evenly distributed compression, soft compression, not cutting into your incisions, even if your scabs have fallen off. To prevent and make sure that swelling doesn't get trapped under those incisions, you need the Amare Lipo foams. Just put them in your garment right over your whole incision, the whole area, one full sheet, and that'll take care of that, and it will start to flatten. Even if you guys are already past that point and you are 3 to 4 months out and you're still having the scarring issues, like the bubble of the scar, or it's thick, or it's like healing ridged and weird, you can still use the foams and it will help soften it and get your body to reabsorb all that stuff. Because what happened is that extracellular mixture, those proteins got stuck in the wound while it was trying to heal. The foams are going to give you that little tiny micro movement in your garment, but also buffer to make sure that all of that stuff, all those grains of sand start floating again to get reabsorbed into your body. Number 2, even if your scabs have fallen off, and I say this all the time, your wound care, the Amare wound care, that stuff heals skin, not just scabs and wounds. It heals skin. The skin is what causes the scarring. If your scabs have fallen off, you are still using that wound care up until 4 months. Sometimes a little bit more, especially if it's red, the skin is red, especially if it's pink, especially if it has color and circulation issues, because that stuff helps repair the skin. It helps for burns, it helps for eczema, it helps for psoriasis, it helps for all skin. I put it on my face. If you guys have been watching my videos for the past couple weeks, I don't know if you guys are keeping up with my face, not that anybody cares, but I had these really big bumps on my face because I hadn't gotten my hair cut in a while, and my hair was touching my face, and I have a condition where my face swells when my hair touches my face. I've mentioned this a couple times, but I use the wound care and it looks incrementally better and has come down so much because it repairs skin. I use the wound care on my face all the time. Every night I apply that stuff to my face because it's just aloe, and then the nanoparticles of colloidal silver are actually working on the things themselves, on the swelling, on the redness. So you should be using that wound care up to like 4 months. If you're still having all of that redness, all of that like the skin is really thin, that we need to get that skin integrity back. That's what the wound care is for. So you got the foams, you got the wound care, and then you should still be using a gentle cleanser because again, that's skin integrity, right? So using that gentle cleanser from the minute you have the incision to shower with, all the way up until it's still skin that's trying to repair, all the way through the healing process. A lot of times, you guys, and this is another problem, you quit once the scab is gone. You're like, oh, okay, I don't need to use this stuff anymore. The scab's off. It's skin now. It's fine. No, it's still healing. It's still healing. All the way up till that 4 to 6 month mark, it's still healing. And then we're getting into the whole actual remodeling phase of making it into a permanent scar. So we don't want to quit halfway through. We want to keep going the whole time. So those are the 3 things that you really need. Other things that you guys are doing that's giving the wound problems with healing and turning it into a scar. Heat. Why are you guys putting heat on your body? Why are you putting heat on your incision that's still like puffy and red? I don't know. I have no idea. You guys are doing it. Really, really, really aggressive massage to the scar to break up scar tissue. Guys, guess what? It's not scar tissue yet. It's still healing tissue. It's not scar tissue. It hasn't made the scar tissue yet. It's still healing tissue. So we don't want to be doing any like aggressive super duper rubbing because again, that skin is really thin. It doesn't have its full integrity yet. And this is the other thing that kills me. You guys with the thick scars, but they're thick and squishy, and you're trying to like squeeze the living daylights out of them, and then you wind up giving yourself like blisters over your incision because the skin is so thin. It's not made yet. I don't know how many times I can say it, but it's not there yet. Couple things that I hear that you guys tell me, your surgeons tell you. Sonobello specifically is so guilty of this at 6 weeks when you still have scabs, putting on scar strips because you don't want them to scar. It's still a scab. It's still a wound. No. But more importantly, when you pull that sheet off, you're ripping the scabs right off your body, and then you're wondering why your wound's taking so long to heal. The other thing I hear is the bio-oil situation. Like I said, using oil on scabs, or even like using the bio-oil when the scabs have just fallen off. The bio-oil is oil, right? It's vitamin oil pretty much, like using vitamin E. It's obviously more than that, but it's oil. We want to hold off and treat that bio-oil like it's the scar stuff. Until that thing is no longer different colors, until it is like skin white, flat, then we can start using that and doing little circular motions, not friction, digging, rubbing. We don't need to do all of that, guys. Gentle, little, that's it. But when we're talking about scars that are thick and fibrotic, the problem is the protein buildup. And if we start scar massage too early, we're going to make it worse, because fibrosis is an inflammatory process. Fibrosis is an inflammatory process. I'm going to say it again. Fibrotic scars and fibrosis is an inflammatory swelling process. So if we're doing things like that deep rubbing, or I was going to get to this, but we'll get to it now, the lasers that you guys are doing on your scars, what you think are scars that are still wounds that are healing with a layer of skin over it, you guys are doing the lasers and machines and all these things when that incision area that has now skin over it is still red and is still pink and is still purple and is still having circulation issues, and you're causing more damage to the area too soon. Wait with all the scar treatments until 6 months, until you have no more swelling, until there's no more inflammation, until there's no more like actual healing processes going on. Just wait. That's another thing, is the lasers. I know there are some surgeons that are like, yeah, we gotta start it right now. We gotta do the laser stuff now, but your incision is still swollen. So you're going to cause more inflammation to an inflamed area. If it's not swollen and it's not red, that's a different story. But if you still have swelling under there and it's still like puffy and squishy, or if it's fibrotic and hard and the whole area, not just your incision, but your tissue itself is fibrotic, don't do anything with it yet. Deal with the swelling and fibrosis first. Get your manual lymphatic drainage massages. Get your lipo foams. Get your post-op gentle cleanser in your wound care, and start taking care of it as if it's still a wound, because it is. You guys don't see it, but it is. So today we're just talking about the outside scars. We're not talking about keloids specifically. We're not talking about hypertrophic specifically. Those are two very different things, and they are very different videos. The process is still the same as far as the swelling, healing, the wound healing with swelling in it. That's what I want you guys to think about. Just, overall, the wound is healing with swelling in it, or it's healing with skin that is damaged. If the skin is damaged while it's healing, whether it be wet and gooey or super, super dry, cracked and flaking and swollen, that's what leads to the scar. We got to take care of those issues, and then we won't even have to worry about a scar. If we take care of those issues first with wound healing, we won't even worry about the scar itself. So water, your foams, your soap, your wound care, and making sure that you're getting the swelling, the excess extracellular mixture, the accumulation of excess swelling out of the body while you're healing, so you don't heal with that stuff in your scars or around the surrounding tissue, causing pressure on the wound internally or externally while it's healing. Again, there are a lot of different ideas about wound care out there, and guys, you are all so individual. Everybody is so different. Everybody's so different with their healing process, with their scars, with your genetics, with your swelling, with your skin, with your collagen and elastin. Everybody is so different. But the basics of it, the general basics of it, the factors that make you scar after surgery. Here's your nice little bow for this video, right? Wrapping it all up. The factors that make you scar, that you can avoid and take care of so that you don't even have to worry about using scar stuff after surgery. You won't even have to worry about all of that craziness. The pressure on the wound, either internal or external. So excess swelling as the wound is healing around the wound. If you're not getting proper manual lymphatic drainage, if you are doing massages that are too aggressive, causing pressure and swelling around the wound, if your garments are cutting into or pressing on the area surrounding the wound itself. I say wound because it could be a tiny pinprick incision or a full scar incision from a tummy tuck or a breast aug or something like that. But the pressure, internal or external, either caused by swelling or caused by something that you're doing that's putting pressure on it, like those aggressive massages or oil rubbing, or the garment itself because you don't have correct foams digging into you. Memory foam will not protect your incision like that. Memory foam will collapse and put pressure on your incision. And you'll feel it too. Memory foam is not the same as the Amare polyurethane foams. So if you're still having issues, it may be your foams causing it. Number 2, the integrity of the skin. Whether you are using Dial Dove or HipaCleanse antibacterial after you have a scab and you are drying and cracking your skin everywhere, which is causing the scar to start being dark, or the wound outside, the skin around the wound to start being dark, or you are using Neosporin, Bacitracin, and Vaseline, and it's taking forever for your wound to heal. You need to get the wound care. We should not be using those wet, gooey things consistently. If you are using an antibiotic ointment that your surgeon gave you, please make sure you are using a thin amount and your incision is hydrated but dry before you put gauze on it. We don't want it to be goopy, right? Number 3, you are doing too many things too soon. This is still a wound. This will stay a wound for a while. How long? Depends on how much swelling, depends on if you're staying hydrated enough with your water, depends on if you are not doing all the scar things too soon and actually letting the wound heal. We need to treat it like it's still a wound. Even if there is no scab and it's just skin, that skin is still very thin. We need to make sure that skin heals properly, and we need to make sure that skin doesn't heal with swelling in it. We need to make sure that that skin is healing nice and strong and flat together. We need to make sure that that skin is not being abused because there's no scab on it and you think that it's fine, and we're just gonna rub away at it and suffocate it with scar stuff and put heat on it and do all these crazy scar massage things or zap it with lasers. We're going to take a breath. We're going to take a breath from all of that. We're going to still treat it like it's a wound. We're going to treat it like it's compromised skin. We're going to use the wound care. Still going to apply 3 coats a day until that thing is no longer red, until it is nice and thin and flat. And thin, I mean like circumference or diameter, not like thin skin, until that integrity of the skin has come back, and then we can see what the actual scar is like to deal with it. But until then, we are treating it as a wound, because that is the number 1 thing that causes you guys to scar, is all the craziness you're doing way too quick. So that is my ramble for today. I hope this was very informative. I hope this was enlightening for you guys. I hope you kind of understand a little bit more about the process of how the wound healing itself is what makes the scar. Guys, stop worrying about it being a scar and start worrying about it being a wound. It will be a game changer for you if you start treating it as a wound and taking care of it as a wound, rather than, oh, I have skin? Okay, I'm going to start worrying about the scar now. Take a breath. Take a breath. We're doing too much too fast. So if you need proper foams, because your foams are not buffering you from the garment and protecting your incisions and protecting your skin, the foams, the detergent for washing your garment in foams, the medical grade detergent, which you should be using anyway, your soap, and your wound care, those are all in our post-op shop, Amare, postopshop.com. You guys can get those. So if you're super worried about your scars, that's your starter pack. If you're super worried about your wounds to make sure they heal right, that's your starter pack right there. You can get all of those on our post-op shop. If you guys, with the manual lymphatic drainage thing, if you are having trouble with your wounds healing, if you are having trouble with your scars and your swelling and your fibrosis, if your scars are starting to heal really bubbled and thick, if your entire surgery area is healing really hard, or really swollen, or the swelling is really stiff and your skin is really stiff and really hard, that's a whole swelling issue. Go get the course. Post-op lymphatic massage and finding a therapist. It is on our post-op shop as well. I walk you through the phases of wound healing, all 4 phases of wound healing. I show you how swelling makes new tissue and where it goes wrong as far as the scarring, the fibrosis, healing with swelling inside of you, all the things that you're doing wrong with your massages because you don't know what your massages are supposed to be. You think it's rubbing. It is not rubbing. It is a gentle pumping motion down to the skin. That's it. But if you don't know what manual lymphatic drainage is, how do you know that the person you're going to is doing the right thing? You don't. So I teach you guys this lymphatic map. I teach you how the sequence is supposed to go. I teach you what your therapist should be doing with their hands. I teach you the pressure they should be using. I teach you why. I teach you how your body reabsorbs swelling. I teach you how to know when you have too much extracellular mixture and it's causing problems. So when to get your lymphatic massages, how many you should be getting, how frequently you should be going, and most importantly, who should be doing them for you, or whom should be doing them for you. So what credentials do they need to have? What letters after their name? What does that mean as far as what their training has been? What you can expect them to know, and what they should be doing in the room with you to make sure that you are reabsorbing that excess swelling so it doesn't cause really bad scarring, so that you don't have scar tissue buildup after liposuction, so that you don't have really thick hypertrophic scars or keloiding scars or any of the scar things. All of that, like healing after lipo or healing after a tummy tuck, all of that internal scar tissue where people have to go for a revision, dog ears, things like that, that's all because you guys aren't properly taking care of your swelling after surgery because you don't know how, and no one's explaining it to you. So I explain it to you in the course so that you know when something's not right with your healing and who to get the help or whom to get the help from. Because that's the problem, is you guys don't know what excess swelling is, and you don't know what's normal and what's not, and you don't know when there's a problem with your surgery, and you don't know when you should start your massages or if you even need them, because you don't know how your body's supposed to be healing. So I break it all down in the course for you. You can enroll in the course and purchase it right on our post-op shop, and the link is going to be in the description box below for our post-op shop as well as the course. So guys, I hope you enjoyed this ramble. I hope it was helpful. I'm going to do another video, one specifically on the keloiding thing and the hypertrophic scar thing. I do have a post with the phases of wound healing, but I think next week I'll do a post showing how a wound heals with swelling and causes like the bad scarring and things like that. I'll put that up next week so you guys get a visual of what I'm talking about when swelling heals under the incision and how that puts pressure on the wound from healing. I'll do that next week. But if you need me, if you need me, I do virtuals so I can help you guys with all of this. If you're doing a virtual with me to try and find an MLD therapist or a manual lymphatic drainage therapist, guys, just take the course, because you'll have me for 4 hours versus 1 hour in a virtual, and then you still don't know what the therapist is supposed to be. Like, I can't be in the room with you guys when you go to get these massages, so I can call them and vet them and tell you what they need to be doing. But then when you get in there, if you don't know all the things about the lymphatic system and how it's supposed to go, you don't know if they're going to be doing the right thing. So if you're doing a virtual with me to find a therapist in your area, that's the reason for the course, because we could spend the 45 minutes teaching you and telling you that, and then you get in the room and you still don't know enough to say this is MLD or this isn't MLD, this isn't what I need. So all of that's in the course. But if you're having if you're having scar issues, if you're having skin healing issues after surgery and you're worried about it scarring, or you're having massive fibrosis, that would be when you see me for a virtual, because then we'd be able to see what in your healing process is going wrong and how we can pivot and flip it so that it starts going right. That would be the point of a virtual. Or if you need help with your garments, or if you need help with your foams and your supplies and all those things. And if you need me in New Jersey as your therapist and to help with all of this, if you want to come in to see me, we are in Highland Park and Elizabeth. So give our office a call to schedule either the virtual or the in-person, 732-841-0142, and our scheduling coordinator will help get you set up with an appointment with me in Jersey or virtual. But if you guys are looking for an MLD therapist, or you're trying to find one in your area, that's why I created the course. I do have links to therapist directories, certification classes that have like directories for therapists. There's 4 links in the course. But more importantly than that, I give you guys the questions and the knowledge to get on the phone before you even get there and say, hey, do you do manual lymphatic drainage? Okay, cool. How does your sequence go? How does it start? What lymph nodes do you address first, second, and third? What are you doing with your hands? Are you doing this? Are you doing it in this way? Is it like this? And they'll be like, yeah, it is. Yeah, this is how VODR, manual lymphatic drainage, is supposed to go. Yeah, this is where I got my certification from. Yeah. These are my credentials. So you can verify them before you even get in the room. Because guys, even if, let's say they're not on the directories, it doesn't mean they're a bad therapist. It just means that they've taken their training elsewhere. Some people have taken their training in Germany directly. They're not going to be on those 4 schools because they went to Germany directly. There are a lot of people on Google that have taken MLD certifications, manual lymphatic drainage certifications, that are wonderful therapists, but you guys don't choose them because you're looking for post-op plastic surgery manual lymphatic drainage therapists. You just need somebody who knows what they're doing with your swelling and your lymphatic system. They don't need to be like me, post-op fairy, manual lymphatic drainage, swelling specialist, everything. They just need to be doing the MLD correctly, because that's what you need them for. The rest of it, you're going to learn in the course with the wound healing and how that works and how much water you're supposed to be drinking and all the different things as far as, you know, your post-op stuff. And then you have me if you need me for your post-op stuff. But you guys are looking for a post-op plastic surgery manual lymphatic drainage therapist when really you just need a really good manual lymphatic drainage therapist. And then all the other post-op stuff is me, my videos, my podcast, my course, me, virtuals. We can help with all of that stuff. But check out the course. It's on the post-op shop. Call me if you need to set up an appointment to come see me. And that's it, guys. Ashley with Amare.